Shelley, can you come and help me turn Mrs. Smith when you have a minute, please?
Sure. Come right in. Barbara, why are you stopping her tube feeding?
Because I'm laying Mrs. Smith flat and I don't want her to aspirate tube feeding.
Well, actually, the research shows that you don't have to do that anymore. It's more detrimental to their recovery if you stop their tube feeding multiple times during the day. It's very minimal risk of aspirating.
I didn't know that. That's good to know. But Mrs. Smith has an NG tube, not a DOPOF. I would think that an NG tube would be more of a risk of aspiration.
There actually isn't. It's about the same.
Oh, well, has Carilion changed their policy about this?
They have. It's been changed for a couple of years now. It's under policies and procedures with the tube feeding policy, and you can find it under other issues and concerns.
Well, thank you, Shelley, for enlightening me on this.
You're very welcome.
Thank you very much. Hello, I'm Barbara Boggs. I've been a Carilion nurse for 17 years and a member of the Nursing Research Council for 3 years. Carilion's mission, vision, and values reflect and support the importance of nursing research. Research promotes excellence in patient care and is the first word and key component in our REACH nursing model. Research, education, advocacy, clinical care, and human touch. On behalf of the Council, thank you for taking the time to participate in our study entitled Frontline Nurse Knowledge, Comfort, and Interest with Conducting Research. We are excited to share the details of our study with you.
I'm Shelley Fizel, Clinical Team Leader on 12 West and Council Member for 3 years. As frontline nurses, we know that our participation in research can be inhibited by lack of time, peer support, fear, and lack of knowledge of the research process, among other things. The purpose of our project was to determine what frontline nurses know and how they feel about participating in research. This was the first step in creating an environment that supports the Carilion nurses' expanded role as a researcher. The study was first determined by the Institutional Review Board to be a quality improvement study. Then we sent an electronic survey to all frontline nurses at Carilion Medical Center. We asked 10 research knowledge questions and 9 questions about comfort and interest in research. The survey was open for 3 weeks in early 2015. 246 frontline nurses completed the survey. The average age of respondent was 41 years and the average number of years in nursing was 15. 50% of the respondents had a BSN degree or higher.
I'm Bobby McKee, Clinical Administrator at Roanoke Memorial Hospital and Council Member for 2 years. The average knowledge score of respondents was 44%. The first knowledge question asked the respondent to identify a useful format for developing a clinical research question. The correct answer was PCOT, patient or problem, intervention, comparison, outcome, and time. Although 23% answered the question correctly, most respondents did not know the answer. Identifying the clinical research problem is the essential and one of the most significant steps in conducting research. Most respondents answered that question correctly. What would you do first to establish a new evidence-based guideline for nursing practice? The first step is to conduct a thorough literature review, and most nurses chose that answer. Reliable and valid tools are essential if you want to be sure that you are accurately measuring what you want to measure. Most nurses who answered our survey chose that answer. Questions that address statistics were difficult for respondents. A significance level describes the probability that a difference between two groups is truly related to our treatment or our intervention. We also identified an opportunity to provide more information about power analysis. Likewise, most nurses did not know how to design a study that collects the best or most appropriate type of media, as described in the research scenario in question 6. Nurses clearly understood the process and definition of informed consent. The question that addressed generalizability or external validity of a study was correctly answered by most respondents, although over 1/4 of the respondents needed assistance with that concept.
Hi, I'm Sunny Cook, a clinical team leader on 7 West PCU and a member of the Nursing Research Council for 1 year. The comfort with an interest in participating in research among our 246 survey respondents was very enlightening. For each item, we used a 0 to 10 scale, with 0 indicating a totally negative response and 10 indicating a totally positive one. The semantic differential scales reflect that frontline nurses who answered our survey tended to feel that nursing research is important to practice and logical and not scary. They also felt less physical response to participating in research. Respondents tended toward neutral in participating in a research team in terms of excitement, eagerness, comfort, and interest. When asked about their interest in leading in research project, most respondents were not interested.
Hello, I'm Wendy Boggs, a frontline nurse in the palliative care unit at CRMH. I've been a member on the council for 3 years. In my nursing program, I was exposed to the research process in a required research class. I admit that it was more like something that I had to get through, not necessarily something I enjoyed. I felt intimidated and didn't really understand how research fit with the nursing profession. I just wanted to take care of people, and I wasn't sure how research would help me accomplish that goal. Nurses truly care about their patients and want to provide exceptional care. Nurses also have great ideas on how to provide that care. I have heard nurses say repeatedly, "I wonder why we do it this way or that way." Questioning care practices and exploring and determining the best practices improves the quality of care we provide our patients. In our survey, we heard most frontline nurses say that they find the research process scary and intimidating, and understandably so. How do you put together a study? Where do you start? Where do you go for help? Here at Carilion, we have many wonderful resources to help bedside nurses with the research process. Your unit representative on the Nursing Research Council is a terrific resource for you. Our knowledgeable library staff can assist you with searching the literature. We also have experienced nurse researchers here who are willing to mentor nurses new to the process. In just a minute, you will hear from Dr. Kim Carter. Kim is our Senior Director of Nursing Research and Evidence-Based Practice, an expert in nursing research and a tremendous help and support with any project. She will review many educational opportunities and services that we have available here. So if you have that burning question that could lead to better patient care, don't be afraid to take the next step. You don't have to do it alone. Lean on our expert resources to help you with each step of your journey.
Hello, I'm Kim Carter, Senior Director of Nursing Research and Evidence-Based Practice. The very best nurses establish new ways of achieving high quality, effective, and efficient care through research and innovations in patient care, nursing, and the practice environment. They conscientiously integrate evidence-based practice and research into clinical operational processes. The very best nurses seek out education and published research that allows them to explore the safest and best practices to benefit their patients. They do not rely just on working through a shift providing care the same way day after day, but rather they question their practice and seek answers to questions like, why do we do it this way? And is this the best way? This is an exciting time for nursing as we broaden our knowledge and understanding to improve care for our patients, improve our work environments, and solve problems using the tools of evidence and research. Carilion provides nurses with resources to support your desire to explore being the best in providing exceptional care that is safe and effective. The CLEAR model, developed and tested by our very own Carilion nurses, will guide you every step of the way. The Office of Nursing Research and Evidence-Based Practice is here for you. We provide basic and advanced research classes, an annual conference, a quarterly peer-reviewed publication, a nursing research fellowship, and consultation at every stage of the study process. We would love to meet with you to develop and explore your practice question, design your study, develop IRB documentation, secure funding, conduct your study, and disseminate through abstracts, posters, podium presentations, and publications. Visit our website on the Inside Carilion intranet site under Research, or contact us. We look forward to working with you to reach for your next level of practice.